Before we get started, I would just like to extend my gratitude to your time and consideration in establishing athletic training services for the Freedom Air Force Base. The first question you might ask is, why athletic training in the military? Isn't that for sports teams and stuff? The first reason is that it will be a huge time saver to have athletic trainers at Freedom Air Force Base. The independent duty medical technicians with each unit are not trained to deal with musculoskeletal injuries. When a cadet receives a musculoskeletal injury, they will be referred to the 10th Medical Group. Each cadet has a wingman, so both of these guys, who are always together while they're in basic training, will have to go to the 10th Medical Group and try to get in there to have their musculoskeletal injury evaluated. Another part of time saving is scheduling. An athletic trainer can schedule around the training schedule on the base rather than setting up an appointment with the 10th Medical Group and losing possibly a whole day. Another big reason is the cost. Around the 6 to 7 week mark, a basic trainee is worth $35,000. Having this cadet leave because of a musculoskeletal injury that could have been treated on base is a huge blow to the finances of the Air Force. Stress fractures are the most common non-mental health reason for leaving. We can address biomechanics to try to prevent stress fractures and other injuries. We need to work on gait and provide appropriate care when these injuries do happen. Injury prevention is the biggest reason that athletic trainers are needed on the Freedom Air Force Base. By addressing the biomechanics, implementing certain training programs, recognizing unsafe conditions, and by helping to make military instructors into better coaches are just a few ways that injuries can be mitigated. These are the policies and procedures that will be implemented with our athletic trainers in the Freedom Air Force Base Athletic Training Services. I would like to say just a little bit about each policy and procedure. The acute asthma attack policy outlines what to do in case of an asthmatic emergency. The bloodborne pathogen policy talks about what they are, protective wear, proper disposal and cleanup, sharp objects, and exposure to bloodborne pathogens. Chemical safety talks about the storage, protective equipment, exposure, and the contact information for poison control. Concussion recognition management and return to participation outlines signs and symptoms, risk factors, diagnostic testing, and a return to activity. Diabetic emergencies are something that will not happen often on base, as diabetics are not allowed to be in the military. It does outline the signs and symptoms of hyperglycemia, hypoglycemia, and the management and treatment of diabetes. Drug testing outlines where the labs are in the United States, what drugs are a violation, and what happens when there is a violation of the drug policy of the U.S. military. Electrical and rehabilitation equipment and maintenance has a list of equipment and lists the contact information for each provider. Emergency management of suspected spinal injuries goes over concussions and vitals, C-spine stabilization, spine boarding, and activating EMS. Health illness prevention, recognition, and management outlines dehydration, exertional hyponatremia, heat cramps, heat exhaustion, stroke, and prevention of these illnesses. Lightning safety outlines the base warning system and how athletic trainers can use the flash to bang method. Over-the-counter medication management has a list of the drugs we have in the athletic training facilities and how a drug log will be taken. Primary and excess insurance policies outline TRICARE, who's eligible, and what cannot be covered. Sickle cell anemia testing is something else our athletic trainers will not need to worry about. Any person with sickle cell trait or sickle cell anemia is not allowed to be in the military. People who have sickle cell trait are at risk for exertional rhabdomyolysis. Skin infections outlines the type, so there's fungal, bacterial, and viral, some common signs and symptoms, and prevention of spreading. This is our proposed floor plan for the Chapman Athletic Training Facility that will be on the Freedom Air Force Base. As you can see, we have 3 offices, a physician's office, a cryo room. We also have 4 exam tables, some storage, some modalities, and then we have a rehab area over on the right where people can do the rehabilitation exercises. We have written emergency action plans for the following facilities: the Chapman Athletic Training Facility, which is located near Eagle Pad, the Patriot Indoor Facility, which houses our indoor weight and cardio area, the Eagle Pad, which is our outdoor training facility, and the Constitution Training Course, which is our off-site Wooded Training Course. These are written to provide step-by-step actions for emergency situations. They address emergency contacts, addresses for each facility, equipment available, protocols, severe weather, fire, and high-risk activities. Before entering the military, each person wishing to enter the military must go through the Military Entrance Processing Station. First, they must take an Armed Services Vocational Aptitude Battery. After passing this test, each person must submit their medical history in order to be eligible to take the physical exams. The physical exams include height and weight, vitals, respiratory testing, hearing, vision, urine analysis, blood testing, and muscle group and joint maneuvers. Anyone who is found to have anything that is not allowed in the military will not be sent to the Freedom Air Force Base. Outlined in your book is our proposed budget and what we would spend it on. Our capital budget was $10,000 and our expendable budget was $25,000. Unfortunately, we were not provided with a budget adequate enough for 1,000 patients. We would like to hire other athletic trainers to work at the Freedom Air Force Base. Duties and responsibility include prevention, evaluation and diagnosis, immediate care, treatment, rehabilitation, and keeping records. Qualifications include minimum of 2 years of experience as a certified athletic trainer, a bachelor or master's degree from a CATIE accredited athletic training program, maintaining an active BOC or Board of Certification, and maintaining an active Washington athletic trainer license. Characteristics of ideal candidates include confidence, communication, empathy, and adaptive. Each year, each athletic trainer is subject to a performance eval by the athletic director. Finally, we will talk about records and documentation. We will record all of our treatments and rehabilitation with SIMS, the Sports Injury Management System. These records will be kept on SIMS for 6 months, where they will then be archived for the next 6 years following the discharge of someone from the military. I would like to thank you for your time and consideration once again, and I look forward to working with you in setting up athletic training services at the Freedom Air Force Base.